this is Alexis Flores. This is my presentation on Osteogenesis Imperfecta, focusing on type 1. Before starting, I'm going to say that I'm presenting to a patient and their family about their new diagnosis. The patient has been diagnosed with type 1 OI and is an adopted child. The patient has a biological mother with OI as well, which they know through background medical history. So I'll be presenting to them. So first to start, what is osteogenesis imperfecta? So to start, I'm put a little small fact there that osteogenesis imperfecta is also known as OI. OI is like a little acronym which is used in many of the sites that I use, and also I will be referring to it as OI. So I included two little things that OI is a disorder based upon abnormal collagen formation, and also most babies is a defect of one of two genes. So osteogenesis imperfecta is a disease that affects 1 in 20,000 people and can range from mild to severe. OI, also known as brittle bone disease, is a defect of one of two genes and affects collagen production. The effect on collagen production can soften bones and connective tissue, which helps support the whole body. This can mean that bones can break easily or even be soft or come out broken out of the womb. Where does it come from? So OI is caused by a random mutation in the gene or can also be inherited. The genes are COLIA1 and COLIA2. When the gene is mutated, collagen production can be slowed or stopped. For this particular patient, the collagen production is just slowed since type 1 is a moderate case of OI. For this particular case, the patient has a biological parent who's also been diagnosed with OI in the past. This can make it be seen as an autosomal dominant trait. As I said, it's an autosomal dominant trait, so between every parent and every two parents, if they have it, there's a 50% chance they can pass on that mutation to their child. So as the mom did have it, as you can imagine, with each of these little things, the circle will be a female and the male will be a square. So the filled in one means that they had osteogenesis imperfecta. So the first circle at the very top right is pretending the mom, and each child has had a 50% chance of getting OI. So the physiology of osteogenesis imperfecta. So the physiology of OI is an incorrect instruction of collagen production. As I've said it previously, collagen production can cause brittle bones or soft bones, which can affect the safety of the patient. There are also 8 types of OI, which all range from mild to moderate or even severe cases. Type 1 is the most moderate or mild case. So collagen strengthens bones, and if the body can't produce enough of it, that's what leads to it. So that is the mutation that happens. Symptoms of OI. Type 1. The symptoms can range from mild to severe for each case. It goes case by case, and not all symptoms will be present in every patient, and also some will present more symptoms than others. So some of the things would be loose joints or muscle weakness, low collagen amounts, loss of strength to teeth because collagen is really present in the teeth. So you'll lose teeth or your teeth will break easily. And then so with having type 1, you might deal with broken bones at a young age and have to be more careful as you participate in activities. I also included a picture next to the symptoms, which shows the difference between a bone that is diagnosed with OI and a healthy bone with a normal collagen production. As you can see, the healthy bone has a more dense population of collagen compared to the bone with osteogenesis imperfecta, which is a little more sparse and a little more kind of looks dead in a way, and which makes it is not as dense because it has a more spaced out collagen. Types of OI. So as I mentioned, there are 8 types of OI, many of them which are very similar and present very similar cases. So I broke them up in just to a few different ones and grouped them together because we are only focusing on OI. So to focus on the first one, there's type 2, 7, and 8. These are all very similar, and most of these patients will have a short humerus, which is the bone in the arm from the wrist to the elbow. These types have frequent death at birth, and if they make it past birth, the patient will have poor muscle development and symptoms may get worse as they grow up, which would be progressive symptoms. So they might even progress to have hearing loss in their future. Type 4, 5, and 6 are also very similar. During birth, these patients might come out with broken bones, and they would have to be put back into place or even go into surgery. These patients experience curved spines and loose joints along with their broken bones, and they may suffer a worse collagen formation than other types. Type 3, which is the one I left by itself, is the most severe type. This type will cause bones to break with little to no trauma. These patients will come out of the room with broken bones and also have lung problems, as well as symptoms of a barrel-shaped chest. These patients will have a very small stature like other types, but it will be also most severe compared to the other types. These patients will be ones that you see that are wheelchair-bound. There is no cure for OI, and all treatments are centered around preventative care and also pain management. Some preventative management would be a balanced diet and a healthy diet that includes a lot of protein as well as exercising regularly in any way possible to strengthen your bones. A good way to do this from the NIH which is the National Institute of Health, is swimming, especially if having a more severe case because there's less room for injury in a pool since there's not as much pressure on your joints and bones. Another thing you can do for preventative care is avoidance of tobacco, alcohol, and caffeine because these can also weaken your bones as well. And then therapy and medicine/surgery we will cover in other things. So medicines and surgery. There are no medications that are allowed by the FDA that are labeled as treatment for OI, and many doctors will prescribe pain medications and medications to help straighten bones. The NIH has just came out with a new treatment that helps for biophosphonates that can help with bone formation and also help decrease the need for surgery. Another treatment also said by the NIH in 2017 talks about an orthopedic treatment called intramedullary rodding. This is when rods are placed into the bones that help with positioning of the legs and help with more normal functioning when necessary compared to having bones that are very soft and may not have as much support. I also put some other things in here that they can be treated with a cast split or braces or even go into surgery. And then some other treatment, like medication things you can do is seeking out occupational therapists, physical therapists, orthodontists, and primary care providers. This would be helpful for if you're trying to go back into the workforce, or physical therapy for helping with those ADLs, which are activities of daily living. Some lifestyle changes. So some lifestyle changes that you can implement into your life is having routine dental and hearing appointments to test your hearing. Not only test your hearing because you can have progressive hearing loss as you grow up, but also checking your dental and having annual checkups with your orthodontist as well as your dentist because collagen is very present in your teeth. So you can have movement of your teeth and also your teeth will break easier. Depending on severity, you can also have the need for walkers, hearing aids, again with that progressive hearing loss, and also in severe cases, wheelchairs. How to find help. There are really good organizations that can help you find support, and you can even join societies to receive updates and newsletters. A really great source to really look into is the Brittle Bone Society and the OIF, which is the Osteogenesis Imperfecta Foundation. These two can help you connect with others who also have similar diagnoses to you. OIF has a search engine that can help you find the closest support group near you. Another two great resources is the Ultragenyx Pharmaceutical Company. This one, which I wrote, a person might also benefit in learning more about their condition, gain access to specific care, or achieve faster access to treatment. So they will help you. They have things to apply to join research studies and also joining studies and also get you included in potential new treatments as well as faster access to treatment and care compared to if you were just to seek out care on your own. The last resource that can help you out is the Brittle Bone Society, where, like many other OI sites, have a section to get financial help in regards to your OI treatment. This can range from doctor's appointments and doctor's care to helping you get assistive devices like wheelchairs. And then these are my citations.